Krosky, and I'm a registered nurse on the medical surgical floor at Bluefield Regional Medical Center. I'm presenting to you the ethical issue regarding nurse-to-patient ratio. I selected the topic of nurse-to-patient ratios because it is an imperative debate in the nursing world at this time. According to an article in the Journal of Healthcare Management, out of 17 of the states that consider staffing legislation either newly introduced or still active since 2008, 12 of those call for mandated nurse-to-patient ratios. The current dispute between those for and those against is significant in that patient quality of care is being addressed along with nurse satisfaction, both of which are major factors in a healthcare system. As a nurse, I'm aware that an issue debating patient safety and care, increased costs, decreased nurse burnout, and staffing flexibility plays a major role throughout the hospital, and that is why it is not only important to me, but essential to all staff in that workplace. Nurses have reported insufficient time with patients, that there's an increase in overtime, 96 out of 100 report fatigue at the beginning of their shift, over 50% report excessive workloads. The majority of nurses work 12-hour shifts, and multiple nurses have reported that their unit is short-staffed. All of which is incentive for improvement if nurse satisfaction comes from mandatory nurse-to-patient ratios. From personal experience, there is always room for improvement in the typical workday and the stresses that accompanies the job of a nurse. So any opportunity to make that change would seem ingenious. As explained in the article found in MedSearch Nursing, the most profound effect of staffing levels is the effect that they have on patient quality of care. The staffing issues not only affect patients, but their loved ones, the nursing staff, and the hospital as a whole. The article also describes the need for laws and legislation in order to support the ethical principles of non-maleficence to avoid causing harm to the patients and beneficence benefiting the patient, both of which are altered when there is an inadequate staffing. In order to take an aim at improving staffing issues, laws have been proposed throughout the United States, mandating nurse-to-patient ratios at all times. A mandated nurse-to-patient ratio, for example, would be 1 nurse per 3 patients in an intensive care setting and 4 patients per 1 registered nurse in the medical surgical setting. Should nurse-to-patient ratios in hospitals be mandated? That is the debate topic that I'm going to present to you. The Online Journal of Issues in Nursing used a study completed on 799 hospitals in 11 states that found that there was a higher prevalence of infections such as urinary tract infections and pneumonia, failure to rescue patients, and cardiac arrest when the nurse's workload was high, as well as an additional study on 168 hospitals in 1999 where it was reported that for each additional patient a nurse was assigned, there was a 7% increase in the likelihood of a patient dying in that nurse's care. These findings were used in the article as primary arguments for setting nurse-to-patient ratios. Those that are for mandating ratios believe that more staff and fewer patients per nurse, there will be better patient outcomes and increased job satisfaction, according to the MedSearch Journal article. It is explained that a higher nurse-to-patient ratio is directly responsible for nurses' job-related burnout and job dissatisfaction. Workers that are satisfied with their job are thought to be more productive and more likely to stay at their present job. Also mentioned is how unrealistic workload creates chronic fatigue for the nurse, poor sleep patterns, and absenteeism. These issues are said to be alleviated with mandatory nurse-to-patient ratios. Also believed by those for the ratios is the fact that there would be a decrease in patient harm such as falls, hospital-acquired infections, and pressure injuries. The Annals of Internal Medicine showed a rationale for a study that suggested increasing the ratio of nurses to patients will lead to decreased illness and even decreased mortality rates. For the people that are against nurse-to-patient ratios, the Online Journal of Nursing Issues reveals their standpoint. It is said that mandatory ratios may result in increased overall cost of care with no guarantee for improvement in any quality of care. In order to meet these ratios, additional registered nurses will have to be hired and there will be no additional payments in the hospitals. In response to not getting reimbursed for the increase in registered nurses having to be hired, hospitals have to decrease other staff such as licensed professional nurses, certified nursing assistants, and housekeeping staff. Also explained in the article is the fact that mandated ratios do not focus on the patient acuity levels. Patients get discharged throughout a shift and soon those beds are replaced by other patients that may be of a higher acuity level than the previous patient. That said nurse then has 4 patients, but those 4 patients may present with more serious health issues in which she would have to care for. In the same article, a medium-sized hospital is considered. An increase of just 1 hour of additional care by a registered nurse per day at $40 an hour would increase costs by $4,000 a day and $1.4 million annually. The American Nurses Association argues that mandated ratios also reduce scheduling and staffing flexibility. These mandated ratios would affect every hospital no matter what the size throughout the state, making it a burden to smaller community hospitals that have lower severity of patients but still have to staff at the same level of the larger hospitals. Creating a single law that applies throughout the state could actually create a situation in which patients receive higher levels of care, which some patients receive higher levels of care than needed while others receive less. In 1999, California became the first state to have minimum nurse-to-patient ratios for hospitals. The law was finalized in 2003 and the state was required to meet staffing ratios as of January 2004. In order to understand more thoroughly, I believe that we should take a look at a state that has actually experienced the results of mandatory nurse-to-patient ratios. A study mentioned in the Journal of Healthcare Management focuses on the state of California and how mandated nurse-to-patient ratios has affected their hospitals. 12 hospitals participated in the study and each hospital had an average of 220 beds. 7 of them were for-profit. 7 of them were not for profit. 4 were public and 1 was for-profit. The registered nurse staff showed satisfaction with their patient workload, but were dissatisfied with issues of decision making, such as when they were able to take their lunch breaks. Most all of the hospitals found it more expensive to hire more registered nurses to meet the staffing requirements on all units at all times. This also caused a backlog of patients in the emergency department waiting to be admitted and a decrease in other ancillary staff. Some hospitals have even hired short shift nurses in order to cover the nurses' lunch breaks for only 3 hours a day. Additional costs have included hiring bonuses and incentives in order to increase the agency's nurses in a time that was very difficult to hire more staff. At the time that the laws went into place in California, there was an actual nursing shortage. Hospital leaders reported that it was very difficult to implement the staffing needs on all units at all times, especially when workers called in sick or there was transfers between units. There are delays in admitting patients to the intensive care units from the emergency room if there's not enough staff in the intensive care units to take on that patient workload. A delay in admitting a patient to the intensive care unit can be very detrimental to that patient. The waiting room in the emergency department may get backed up at times when there is an influx of patients if there is not enough nurses in the ER to take care of those patients. However, some leaders did say that nursing turnover has decreased, the nursing burnout has been reduced, and nurses are more pleased to have a lower patient load. Nursing Economics commented on California workers' satisfaction after the ratios were put into place and stated that more nurses are satisfied today than before the ratios. Nevertheless, far too many still have job dissatisfaction scores that were neutral or even worse than they were before. Currently, in the year of 2017, California is the only state that stipulates in law a required minimum nurse-to-patient ratio to be mandated at all times by their units. Other states participate in staffing laws, but not specifically mandated nurse-to-patient ratios. It is obvious that each side of this debate topic contains valid points. It is essential that each state weigh out the pros versus the cons in order to come to the conclusion of whether or not the state should adopt the law to mandate nurse-to-patient ratios or not.